my identification that you do all your first steps. Got a female. And typically with a female, and you can even do this with a male too, but yeah, you can do this with a male. And that is to take the covers and try to keep the patient a little covered up, because there's a lot of exposure during this procedure, as we know, but we really can't keep a cover over the lower legs. When I was in nursing, we were shown how to wrap a bath blanket around each leg prior to doing this procedure. It's like, okay, that's overkill. Let's just get the procedure done. So I tell them, I'm going to keep you as covered up as I can for this. I'm going to be working between your legs, so I'm just starting to get things ready here, okay? And with a female, a lot of times if you're going to get to the urethra, you definitely got to bend the legs up and kind of get the hips tilted up a little bit, okay? So if I have a female that can't stay in this position, I'm always going to grab one of my colleagues to come and help me hold the legs open, okay? So I got my kit. I'm ready to take off and go. So you guys are going to be opening your kit, pulling your box outside the bag, and you can actually take the bag and make it as wide open as you can, because you're probably going to miss throwing stuff in there, but it doesn't matter when you're on your sterile part of things. Okay, so I got my kit, and please put your foot down, thank you. In between the legs, and I'm opening my kit, first flap always away from me, and then the side flaps, and then the final flap. And the first thing I'm gonna get is a drape that I can touch on the edges. I'm going to hope that drape falls open as I'm opening it. Want the shiny side down, because if the shiny side's up, liquid will just roll off onto my sheets. If you put the shiny side up, it's okay, you'll live. It's still sterile. Okay, so I've got a sterile field. I'm gonna get it to lay down by coming this way and kind of just letting it fall into place. So you notice that I did not pick up my sterile field and put it down like this and have my arms crossing in any way. Or maybe have it like this and have this arm crossing this field. I got it by the edges. I brought my arms up over the patient and just let it fall between those open legs. Do I want to use this?
Yeah.
Okay, I don't want to use it for a female. It will only get in the way. I know you guys are all going to say, well, I'm going to try it this time. And you're going to find while you're trying to do your procedure that darn thing gets in the way and probably messes up your sterile field. These are great for a male, however. Okay, I'm going to drop it over a male. And even if they don't stick out of there, it doesn't matter. I've dropped it in place. I'm going to get everything ready. And then with this hand, I can get to what I need to on a male. Perfect for a male. When I pick it up out of a female kit, I just toss it to the side. And then the next thing that should be in here actually is my sterile gloves. And remember, my kit is sitting on the big drape right now too. All right, so coming over here to get my gloves on. And you guys always know what a joy it is to get procedure gloves on in a sterile manner, right?
Mm-hmm.
Want to get all my fingers hidden before I bring that other hand near this. Thumb hitchhiked out. All right. I say, what is this? I don't need this. And so I start to play with my stuff. I'm down in the center of my field. I'm gonna get my swab sticks open. I know you guys have cotton balls and forceps probably in yours. If you have the swab sticks, you don't want to just open them and set them there, because I guarantee when you're holding your patient and you go to get one of these out one-handed, you're not going to be able to get one out, okay? So what you do is, if you have swab sticks, you open them up and you just set them all somewhere in your tray. I don't think I have much lube. I'm going to squirt my lube anywhere, no particular compartment. I'm gonna get my syringe. for balloon inflation. Doesn't matter where I drop these things, they're all sterile coming out of my kit. Have that ready to go, and I have pretty much everything ready to go. I am gonna actually carefully get my catheter out of here. And these are tricky because they're very flingy, flexible little things. And I will typically lube up my catheter and either just set it back out of the way or wherever it's gonna sit for me, where I can grab it one-handed. And I'm ready to go. So I'm gonna get a hold of a female, and actually I'm gonna use my sterile hand to get that to go down. And my best suggestion to you is to actually take these two fingers on your hand and set them inside the vagina, okay? And then grab a hold of tissue and pull it open. You kind of pull open and up on the tissue. Because if you just go to try to spread, you are often not going to see the urethra. And you often have more to spread than you realize. And if you just, and I usually tell my patient, you're going to feel me touch you now. And a lot of times I'll touch their inner thigh and then I'll touch them. Because that quells that jump sensation, okay? I'm getting ready to touch you now. And so put your fingers inside the vagina. It helps you just be able to spread and pull up. And you have got to visualize that meatus before you can start to clean it. So you just can't open things up and say, you know, I know it's in there, I'm gonna be going somewhere in there with my catheter and start to do your prep. You need to visualize it. And I will tell you, when a female is laying supine in a bed, the meatus opening does not go in this direction. It goes in this direction. So often you've got your head down here, and you have to be careful so you don't fall in there, because you know, we've lost students that way, and it's like, where's the student? They were here a minute ago.
R.I.P.
Just got sucked
Never.
up like an alien.
So in
Black
other words,
hole.
you've got to see where you're going. And then you can count. This hand's going to get a little tired holding things open and holding tissue out of the way. And that's why I say all students need to catheterize a 400-pound female as a rite of passage. And once you can do that and actually get through all that tissue and find that opening, you can say, I have gone through a major rite of passage and I can do it all. Okay, so I see the meatus. Picking up my swab, am I going right down the middle?
No.
Okay, so I usually choose the side away from me. I'm gonna go down that. I'm sort of in the labia minora. I'm not gonna bring my hand back over my sterile field. So I have swabbed down that side. I'm coming over here, dropping. Picking up my next swab, going down the top on the other side, down very close to the meatus, because remember, that's where we're trying to get the bacteria from. Pulling away, and then I'm gonna go straight down the middle and definitely make sure I get that meatus, because that's where I'm pushing on an object in. Ready to grab my catheter. Maybe I lube last, now that I'm just doing it naturally. Holding very close, going right for that meatus and inserting. And the minute I see urine coming down my catheter, I'm gonna insert probably a couple more inches. And then I can grab the catheter with this hand. You usually want to grab it an inch or two below the meatus though, so you don't touch right where it's going in. Grab your syringe, inflate your balloon quickly, and now you can let go with both hands, okay? Woo. Have a little blow up. I'll pull gently till the catheter is at the bottom of the bladder and secure the catheter. La-da. And I think that's all I would have really said to show you guys. I don't know if you saw anything different or you have any questions.
Do you date the catheter? Or is that just in the record?
Typically, yes, you're gonna get a leg anchor, and a lot of times they come in another package that you put on the leg, and it actually has a peel-off label that you date time initial, stick it back on, which is always a good practice to date time initial anything you have stuck on a patient. And that's all there is to it.
Did you ever have?
things with removing it that you'd like to see us do when we're done with this procedure?
No, what would be the most important consideration when you're removing a catheter?
That you have the balloon? Is it
Deflating
shed?
the balloon, that's all I need to hear.
I did it in the hospital. That's the only reason why I know.
Okay.
And I was
There's
like,
nothing
this is...
to it. Patient can be up in a chair or wherever, doesn't matter, but as long as you deflate the balloon, that's all. All you have to do is go to the supply card, get a 10 ml syringe. I will say that, okay, so when I go to deflate a balloon, I usually bring a towel, put it under the patient, and I will attach, I'll deflate the balloon, and they're usually inflated with about 10 ml. I will take and squirt that saline right on the towel. I'll reattach the syringe and try to deflate once more, because you are going to be surprised how many times you go to DC a Foley and some nurse, I don't know who it was, double inflated that balloon with like 20 ml. And here you could have taken 10 ml out, pulled that catheter, and found out there's still a balloon that you've just pulled through the urethra, especially on a male. You're going to traumatize the urethra mucosa. So I always double check to make sure that's deflated. And, you know, if I were to just pull back and I'm just getting resistance, I know it's deflated, I can pull it. And the reason I have a towel, and especially for a male, is as I start to pull it, I wrap the towel around the catheter. And with a male, you're wrapping and wrapping and wrapping as you pull, okay? There's usually no sensation with the removal of a catheter. And the reason I cover it as it's coming out is because if you were to pull this out of a male and not wrap it, it'll fling something in your face, okay? So it works very well to wrap it right as you're pulling, and continue to wrap as you're pulling it out, and then you're just gonna take and measure the urine or ditch the whole thing anyways. All right?
And that goes in regular trash?
Yep. Yep.
Is there ever going to be a time where you have a hard time inserting it into a female, or is there?
No. The hardest thing you'll find with females is
Just
being able to see
finding it.
where the darn urethra is.
Okay.
Because you'll run into different anatomies, and it's like, you know, where the heck is this thing? So you're even consulting with your fellow, you know, students. Is that
Got like
it?
10 people
Or
in there just
is
looking
that
at
it?
them and trying
I
to
told you
find
about
a
my
uterus.
first Cath experience, didn't I? In the hospital?
I don't think so.
Oh, I didn't?
No.
Oh. Okay. So obviously you have a number of holes to pick from on a female, as opposed to a male, you usually know where to go, right? So I remember going in there with this other new grad. We were both like 21 or 22, all giggling, walking around doing our nursing, and it's like, okay, we gotta put a catheter on this lady. So I was doing it, and it's like, so we're down here, I'm cleaning her, it's like, I'm looking at her, it's like, and she's looking, it's like, so I'm taking the catheter, I'm sticking it in, and the lady's like rising off the bed. She's going, oh, I think you're on the wrong spot. Okay, so I was cathing her clitoris, okay? And I didn't even know it. It's like, okay, here we are, two females, we don't even know our own female anatomy. It's like, okay, well, I guess that wasn't it. That must be it. Okay, we'll be right back. So we have to get another catheter. And so the biggest mistake you'll make is you think you saw it and you got the catheter in the vagina. And so if you think you know your anatomy, all you who have had anatomy,
So that's why men are so confused.
where is that meatus in the female anatomy? Above the vagina, good place to start. So if you can look down here and see the vaginal opening, honestly, you've got to pull tissue up and apart. And you see the vaginal opening, you look right above it, you're gonna see that little slit, and that is your meatus, okay? So you're doing good if you can see the vaginal opening, okay? You know you're not gonna put it there. And even though you think,
Step one.
okay, because you're never gonna see something like that. Well, on a few people it's actually that visible. But you're gonna see something like this. You're gonna see the vaginal opening. This is a pretty good representation. And you are actually looking right up in here in the labia minora, okay, for the little tiny meatus. So it's a challenge, and you want to feel like you conquered Mount Everest after you get done. It's like, I think I found the spot, you know? It's always a happy thing, okay? Our goal is to be successful. So good luck to y'all. May the force be with you.
So if you do stick it in the wrong hole,
Oh yeah.
are you supposed to get a new catheter? Or
And leave that one in place, because chances are you're going to end up in the vagina. So you've stuck it in, it's like, oh wow, there's no urine coming. We're definitely not in the meatus. You leave that laying there. You leave it in them. Go get a new kit, open up, do your sterile field. When you put your drape down, it goes over that catheter you've just worked with. And when you go to put the next catheter in, you can see where that original catheter is sticking, and you know, I gotta try for a different spot.
Not that one this time.
Yeah.
A different hole.
Yeah.
enter through the wrong hole and then put it into the meatus?
What's that?
Like with the same catheter?
Yeah, with the same
Just like
catheter.
take the catheter out of the vagina and put it in
So
the
they're
meatus?
contributing
Yeah.
to
So,
nosocomial infections.
so this is a good example of the fact that you are going out there, you're an independent practitioner with your own license. Nobody is going to be policing what you do. We trust that nurses all went through the most accurate schooling, that everyone gets taught the same way. And what you do when you get out there, your ethics, how sloppy you are, that's your own work ethic and standard that you hold yourself to. You get told the right thing to do, whether you go out there and do it, is always going to be up to you. You're going to see plenty of nurses contaminate and then continue with what they're doing. If I observe a contamination that was so outright could bring harm to this patient, like an infection that could end up killing them because they're already so vulnerable and ill, I might have to bring it to someone's attention.
So would something
It
like
is
this would
very
be,
difficult to even think of approaching a superior and having to say something about a coworker. Can't tell you how much that will kill you. So I believe that if I was doing something, I would rather have someone come up to me than to have to go to someone else and talk to them about it, and never felt like they could at least come to talk to me about it. So a good thing to do if you're ever in that situation and it's hard to confront, the minute you see it happen, say as fast as you can, would you like me to get you another catheter? That's all you have to do. And a lot of nurses are conscious going to tell them, yes, I know what I did. Okay, if you could please go get one. It saves confronting them with, you just outright contaminated. You don't make any accusations. But if you ever see someone contaminate gloves, would you like me to get you another pair of gloves? Anything, quickly. And you will have averted at least maybe some harm to the patient. And then it's like, okay, how many times is this person doing this? I'm not here to follow them around and watch what they're doing. But again, you get out there with your own standards, you learn right and wrong. Whether you do that, I will never know. But I would hope you would choose to want to be the best you can be at your chosen profession. Okay, it's all up to you guys.